health and a little wealth and a lot of love.
So we want to start out with our first segment, which is our more popular segment, which is Refactions. Refactions! In this segment, we'll be reacting
and fact-checking
on viral content. Get it? Refactions! All right, let's play it.
My parents were spending the night. These are her nighttime drugs. And this is his bag of drugs. And then we have different things for the morning so we can golf and not hurt.
Or have heart attacks and die.
Or have heart attacks. That's the dog. Wow, Jesus. Do you take all these? Mm-hmm. Wow. And you know what? By looking at them, you wouldn't know it. They don't look like druggies. They're pretty healthy.
So I counted the bottles, actually, when the YouTube was playing, but the one that she was showing is like 12 to 15 bottles of pills. I do not, like I take a supplement every day, but I do not want to be a slave to pills. So what is your reaction to, or refaction to this short? That was a good one.
Yeah, so I think this is something that we see a lot in medicine. It is not an isolated incident. We can first talk about a little bit of the specifics and statistics. So according to the CDC and the National Center for Health Statistics.
What's CDC?
The Center for Disease Control.
Got it.
49% of the U.S. population have used at least one prescription medication within the last 30 days. So half of our population has used at least one prescription med within the last month.
Yikes.
24% have used 3 or more within the last 30 days, so 3 prescription medications.
It's like 30%, that's almost 1/3.
Yeah, and then 13% have used 5 or more. 5 or more.
10% of our population?
Over 10%. And then this is another staggering statistic. So 54% of adults older than 65 take 4 or more prescription drugs. And that's on a regular, continuous basis. So half of adults 65 and older are taking a significant amount of medications. And honestly, there are a lot that take more than that. And if you go up in age, that number tends to only increase.
Yikes. I almost feel like it's a fountain of youth, but I feel like there's, and I know we'll probably get into it, so tell me to put a pin in it, but when you take medication, I feel like there's always some sort of side effect. There's always some sort of side effect. So you're fixing this thing, and then you have this thing, and then you take another medicine for this thing, that's to get that thing. Can you just treat the symptom and the problem? But I'm pretty sure that's probably what you're going to talk about today. I haven't seen the script. It's always good for us to surprise each other, so that way we're in your shoes as a listener, because we don't know about our own fields. Okay, cool. So that was our first segment.
That was our segment for today.
With a little health and a little wealth and a lot of love. That's the life that we live. Susan Scruggs.